Before starting Belimumab, make sure to read the medication guide given by your pharmacist. This medication is administered by a healthcare professional through an injection into a vein over 1 hour. Your doctor will determine the dosage based on your weight, and you will typically receive the injection every 2 weeks for the first 3 doses, then every 4 weeks thereafter. Your doctor may also prescribe other medications for you to take before starting the treatment to help prevent serious side effects. It's important to note that this medication may cause very serious reactions, especially during the first and second treatments. Your doctor will closely monitor you for any reactions, and if any occur, your treatment will be temporarily stopped. It is important to use this medication regularly to get the most benefit from it. You may find it helpful to mark your calendar with a reminder. If you experience any side effects or if your condition does not improve, be sure to inform your doctor. If you experience nausea, diarrhea, or trouble sleeping while taking Belimumab solution, let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it may lower your ability to fight infections. Be sure to tell your doctor if you notice any signs of infection, such as a persistent sore throat, fever, or cough. In rare cases, Belimumab solution may increase your risk of developing cancers, including skin cancer, or a serious brain infection called progressive multifocal leukoencephalopathy, PML. Contact your doctor immediately if you experience any symptoms of these conditions, such as new skin lesions, changes in mole size or color, or difficulties with coordination, balance, or thinking. Additionally, seek medical help right away if you notice any signs of heart problems or a serious allergic reaction, such as rash, swelling, dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Belimumab, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. It is also important to discuss your medical history with your doctor, especially if you have had infections, mental/mood problems, or cancer. Belimumab may increase your risk of getting infections or worsen current infections. It is important to avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. Be sure to discuss your vaccine history with your doctor and ask if you need any vaccines before starting treatment with this medication. It's also important to inform your healthcare professional if you are using Belimumab before receiving any immunizations or vaccinations, and to avoid contact with people who have recently received live vaccines. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Belimumab should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. This medication can also pass into breast milk, so it's important to consult your doctor before breastfeeding while using Belimumab. Interactions with other drugs can affect how well your medications work or increase the chance of experiencing serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with Belimumab solution, Reconstituted, Recon Soln, include other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can reach out to a provincial poison control center. Your doctor may order lab or medical tests while you are taking Belimumab solution, Reconstituted. Make sure to attend all scheduled appointments for these tests. It's important to consult with your doctor for more information about this. Remember, it's crucial to take your prescribed dose of Belimumab solution, Reconstituted, on time. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication, Belimumab solution, Reconstituted, Recon Soln, is given in a clinic and should not be stored at home. It is used to treat certain types of lupus in adults. Your healthcare provider will determine the correct dose for you and the frequency of administration. It is important to follow their instructions carefully. This medication is usually given once a week, on the same day each week. It is administered as an infusion, which means it is slowly injected into a vein over a period of time. It is important to receive this medication on a regular schedule to get the most benefit from it. If you have any questions or concerns about the timing of your doses, be sure to talk to your healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.